why it's not going? But you started, Dave. Okay. Okay. Okay, we're going to get started. We start promptly at 12 o'clock because we have a lot of people listening in via the web, on the air, so to speak. Please take your seats as quickly and as quietly as you can. We don't give the people on the air lunch, so they get jealous when they hear you eating. For those attending via the webinar, we cannot hear you. We've got you on mute, but hopefully we're not on mute. And if you are having a problem, please send us a message via the webinar messenger tool. You should see in the upper right-hand window for webinar, there's a place where you can put a message in and send it to us, and we'll try to address whatever the issue is. You can also use that field to send us questions which we can potentially address during the question and answer period at the end of the forum. And if you want to make that window as small as possible to minimize it, you should find two arrows pointing to the right up in the upper left-hand corner of that window. Just click on that and it'll move over. And later on, if you want to maximize it, you can click on the arrows pointing to the left, which will appear after you click on the arrows pointing to the right. So, welcome everybody. I'm David Stapleton, the Director of Mathematica Center for Studying Disability Policy. This is our 7th policy forum on disability policy research. The topic today is disability and poverty, and I'll get to what is the connection and what should we do about it. The origin of this topic is work that Gina Livermore and Bonnie O'Day and Andy Imparato and I started, I think in 2004, although it's so long ago I can hardly remember, for a paper that was eventually published in the Milbank Quarterly called Dismantling the Poverty Trap, Disability Policy for the 21st Century, and that's the full citation there. The first point of this paper was that current policy traps many people with disability in long-term poverty. They cannot earn enough on their own to stay out of poverty, and the benefit payments that are made through the programs that they're eligible for are often not enough by themselves to keep them out of poverty, and we don't have very good alternatives under which they can get some benefits and also earn enough money to keep themselves out of poverty. So that was the point of this paper, and to support that point, when we were writing the paper, we thought we ought to put in some statistics about people with disabilities and their poverty rates, and what we found, it was really tough to find those statistics. There was very little research. In fact, if you look at the whole poverty literature, you find that people with disabilities get very little attention. Instead, it focuses on other, quote, vulnerable groups, often low-income families, single-parent families, especially mothers, and racial and ethnic minorities, but very little that's focused on people with disabilities. So that finding didn't prevent us from writing that paper, but it did lead us on into other research on poverty and disability. And Gina Livermore completed a couple of research projects with a former colleague, Pei-Yun Shi, and she's going to actually be our first speaker today and talk about those two projects, the findings from those. The second speaker is Sean Fremstad. Sean independently, and more recently I think, became interested in the connection between disability and poverty, and at some point he discovered the papers that Gina and Pei-Yun had written. In September, timed to coincide with the Census Bureau's annual release of poverty statistics, he produced a report that was titled Half in 10, Why Taking Disability into Account is Essential to Reducing Income Poverty and Expanding Economic Inclusion. He reviews the evidence on poverty and disability and discusses the implications for both poverty policy and poverty measurement. So after seeing Sean's report and talking to him, we decided to conduct this month's forum on disability and poverty. So Sean is an attorney by training. He has written extensively on a broad range of social and fiscal policy issues. He's currently the director of the Inclusive and Sustainable Economic Initiative at the Center for Economic and Policy Research. Past work includes stints as a stint as the Deputy Director of Income Security at the Center on Budget and Policy Priorities. So we're very pleased that Sean is here with us today. We're also very pleased that Pamela Loprest from the Urban Institute agreed to participate in the forum as a third speaker. Pam is one of the few policy researchers with wide-ranging expertise in poverty issues who has been paying substantial attention to disability policy for many years. So we invited her to offer her own perspective on this very important topic. So our plan is to have the speakers, one after another, finish up by approximately 1 o'clock. After that, we'll have a question and answer period, and we'll take questions both from in the room as well as remotely. Before I turn the microphone over to the first speaker, Gina, I'd also like to acknowledge the fact that the research that Gina will report on today, as well as a lot of our research that we've done in the area of employment and disability and poverty, is funded by the National Institute for Disability and Rehabilitation Research. And I noticed that I think we have 4 people here from NIDR, so I thought it was important to point that out. And but also want to express our gratitude for the funding that we've gotten over the years. I also want to say, as Edgar would want me to, that the contents of the presentations do not necessarily represent the policy of the Department of Education, and you should not assume that endorsement by the federal government. So, without further ado, Gina.
What'd you do with the Thanks, Dave. Oops. Steve said I'm going to present quite a few statistics today from 2 papers looking at poverty and hardship among working-age people with disabilities. And just a couple of caveats. This all focuses on working-age people, and that's defined differently on different slides, but predominantly age 25 to 61 is what we used in our study, so post-school, pre-retirement age. It is also looking at individuals rather than families, and it's also predominantly using an old version of the Survey of Income Program participation covering the period 1996 to 1999, and that's because that's what we had available at the time when we began this work. Since then, there's been other panels, another panel published, but it allowed us to look at 4 years of data instead of one point in time and look at over a longer period. So let's see. All right, so I'm first going to present some poverty rates among working-age people with disabilities and compare them just for context to some other groups, and then look at the share of the working-age population that's in poverty that are people with disabilities or experience a disability, and also look at long-term poverty, poverty over more than just an annual period, 4-year period we have, and then also look at material hardship experiences among people with disabilities. And you know, when we started doing this research and getting some of the numbers back, I was quite alarmed by what I saw. And, you know, we think, okay, if people have disabilities and they're working age, of course they're going to be poor because they can't work. And when you see some of these numbers, and you know, and they may be alarming to you or not, but should we really, you know, should that be our assumption? And going forward, what can we really do to change that? Those kinds of discussions, it seems like, aren't in the forefront of welfare and policies for low-income workers and so forth. It's some of the numbers are quite large. Okay. I'm not doing it right now. There it is. Okay, so just really quickly, how our official definition of poverty is based on one that was developed a long time ago in the 60s, and it's they developed it based on the cost of how much food it would take, the minimum amount of food you would need, a family would need, and then the assumption that you spend 1/3 of your income on the family. So that's where the definition originally came from, and then every year it just keeps getting updated based on cost of living adjustments. And so they determine a threshold. If you fall below that, if your family income falls below that, you're considered in poverty. If you're above that, you're not. So that's how they measure it. And it's based on family income, household income, and then all members in that household would be considered in poverty. So just to give some benchmarks here, the most recent thresholds are they're always lag a year because you need to have the whole year go by before you can determine the threshold. So for the official definitions, the thresholds for 2008 are about $11,000 for an individual under age 65 and about $22,000 for a 4-person household. So this slide shows some poverty rates, and they're not directly comparable. The colors they come from different sources. The black numbers are the official Census Bureau rates for 2008, and overall 13% of the U.S. population is in poverty. The red numbers come from the American Community Survey, and those are numbers people with disabilities and without disabilities, using the American Community disability questions in there. And working age people without disabilities, you see 10%, and working age people with disabilities are 25% in poverty. Now, oops, yeah, right there. Now, these are numbers from a National Beneficiary Survey. It's a survey sponsored by the Social Security Administration, representative of all Social Security Disability Insurance, DI beneficiaries, and Supplemental Security Income beneficiaries. And based on data from that survey, poverty rates for people on DI only are 31%, and people on SSI, it is 72%. And given the criteria for getting on SSI, it's a means-tested program. You pretty much have to be in poverty to even get on it. You might wonder why that number isn't closer to 100%. Well, states can supplement the SSI, so that might inch some people over the poverty line. And earned income is also treated differently in the program, so a small share of those people actually might have been able to earn their way out of poverty as well. So looking at the numbers of people in poverty, 5.9 million working age individuals, and here it's 16 to 64 in poverty. And when you compare that to the total number of the beneficiaries, DI beneficiaries and SSI beneficiaries, you see that the two numbers together, 4.9 million of the 5.9 million, and it's a little bit apples and oranges, but roughly over 80% of the working age people with disabilities in our country that are in poverty are in these programs. And another point of comparison, if you look at another population that gets a lot of attention in the welfare literature, the single female, the single mothers with kids, you see that people with disabilities outnumber them. And this, to be fair, this does not include their children and other people in the households. If you did that, then the total household would probably outnumber the people with disabilities. But there are more people with disabilities, working age people with disabilities, that are in poverty than there are single mothers with children. Okay, this slide now is shifting to the 1996 to 99 SIP. The point here is just to show that poverty rates will be different depending on how you define disability, and the SIP gives you a million ways to define it. They do functional limitations at 2 points in time for the panel in 1997 and 1999. They do work limitations at every interview, so you have the monthly measures of that over a 4-year period, and you can define it by severity. Do you just have 1 or 2 limitations? Do you need assistance performing activities of daily living? So in general, the more severe your disability, the higher the rate of poverty will be. And at the bottom I have here no work limitation, 5% poverty rate. And at the very top, it's people who reported that because of a physical or mental health condition, they were prevented from working in all months of 1997. There is a 32% poverty rate among those individuals. And these are annual poverty rates based on your whole year income for 1997. Now, another way to look at this is over a longer period, and we looked at a 48-month period and counted the number of months in that 48 months you were in poverty. So it gets away from that annual measure, looking at annual income. Now we're looking at monthly income and then just counting up what share of that 48-month period you spent in poverty. And we also looked at differences across how long you had your disability as measured by the work limitation one, which is monthly. We had some measures for that, as well as did you have a disability when the SIP talked to you in 97 or 99 or in both years. So the first bar is people that reported no limitations in either 97 or 99, and 10% of them experienced poverty for more than 12 months of the 48-month period. The next bar is people who had reported functional limitation in one of the years but not both years, 17%. The red bar is people we might think of as long-term disabilities. They reported having functional limitations at both interviews, 29% poverty rate. And then on the end, the 40% poverty rate is people that said they were work limited, not necessarily prevented from working, but they were not, their work was limited due to disability for more than 36 of the 48 months. They have very high poverty rates. Okay, and the next side of this is really a long-term poverty measure, and it's people who have been in poverty for more than 36 months of that 48-month period. And in general, poverty research has shown that people don't spend a lot of time in poverty. The episodes are pretty short. They might go in and out over a period several times, but they don't stay there for long, long periods of time. And as you see among people without disabilities, the black one, it's very rare. 3% were in for 36 of the 48 months. But on the other end of the spectrum, you look at the people with work limitations, long-term work limitations. 1 in 5 of those people spent most of that 4-year period in poverty. And this is just another way to look at the previous slide. What are your chances of staying in poverty if you're there for at least a year? And if you have no functional limitations or just a short-term functional limitation, it's about 1 in 4, 1 in 3. But if you have a long-term disability, your chances are you're twice as likely to stay in poverty once you get there. 51% of those with the long-term work limitations stayed in poverty for more than 36 of the 48 months. So we see the poverty rates among people with disabilities, and people with disabilities are a minority of the working age population. In the SIP, they're kind of high because there's so many measures to measure them. It's about 18%. But what share do they make up of the poverty population? Well, using an annual poverty measure, in 1997, the poverty rate among all those aged 25 to 61 was 8%. And of that 8%, nearly half of them, 47%, were people who reported having a disability of some sort in that year. So they represent about half of the working age poverty population. Looking at the long-term measure, that 36 months in poverty out of 48 months, that's relatively rare. Only 4% overall of the working age population experienced poverty for that many months. But of that group, the majority, 65%, were people who reported a disability at some point during that 48-month period. So they definitely represent the majority of people who are experiencing long-term poverty, and nearly the majority, or half of those experiencing annual poverty. So another way to look at economic well-being, there's lots of problems with the poverty measure. Just based on the definition, you might think of a lot on your own with it. It's been highly criticized, and but it's what we have, and there's time trends, and it's a good marker for things, and we build programs around eligibility requirements for programs around it. So it's an institution, and it's probably not going to go away. But people have looked at other ways to look at economic well-being, and material hardship is one of those measures. And material hardship refers to hardship with respect to the consumption of material items that are thought to be necessary to meet your basic needs. And in the Survey of Income Program Participation, there's several of them. We just looked at 6 of them, and they're listed here. Unable, and they were asked in 1998 about this, and all of them except the last one, they're asking about the previous 12 months, how often you were unable to meet your expenses, unable to pay your rent or mortgage, unable to pay your utility bills, unable to get needed medical care, unable to get needed dental care. And the food insecurity ones, they ask about the previous 4 months, and it's a scale that was developed by the USDA, and based on your responses to 5 questions, you're either categorized as food secure, you don't have a problem with getting food, food insecure without hunger, meaning you have some hardships associated with it, but you're not going hungry, and then food insecurity with hunger is probably the most severe of that hardship. And I'm just showing a couple of them up here, not all of them. And this is for people below the poverty level, income below the poverty level, the likelihood of experiencing a couple of these hardships. And you might expect that people with disabilities would have more trouble getting needed medical care because their needs are greater. And you do see it's probably not as extreme as you might expect, because people with disabilities also tend to be more likely to be insured than other people. So Medicare and Medicaid is probably keeping that down somewhat. But 20% of, well, let me first define the colors here. Again, it's black is no work limitation. The gray is you had a limitation in 1998 when you were asked these questions, but you had it for less than a year, so short-term disability or short-term limitation measure. And the red is you had a work limitation in 1988, and you'd had it for longer than a year, so long-term disability measures. And one of the interesting things here is that well, in the previous slides I showed you poverty rates were, they went up with severity and they go up with duration. Here, material hardship, you see people of the same duration or of different durations, short or long-term disabilities, are experiencing hardships at the same rates, or even people with short-term disabilities higher than the long-term disabilities. And there's a lot of reasons why that might be that I won't get into, but it's kind of interesting to see that even if you're not looking at poverty or income measures, that looking at material hardships, short-term and long-term disability is just as equally problematic. So the last column, well, food insecurity with hunger, I'll talk about that one. That's generally really rare in the general population, and it's even among people who are in poverty, it's fairly rare. But when you think of 1 in 5 of people with disabilities and poverty are reporting hunger, I mean, that's a pretty big number. And it's a recent period. We're talking about the previous 4 months, not the whole year, like some of the other measures. And the experience of any of the 6 hardships that I listed on that one, very high among all the groups of people in poverty, whether you have a disability or not, but extremely high among those with short-term disability, 69%. Now, the next side of this is just to show you, as your income goes up, yeah, your likelihood of experiencing hardships goes down. On this side, we have the same disability groups, but their income is more than twice the poverty level. And you still see that people with disabilities are experiencing at least one of the 6 hardships at fairly high rates. Those with the long-term disabilities, close to 1 in 3 are still reporting hardships. So looking at, again, what share of the people experiencing hardships in general have disabilities. And the whole bar here represents all the people with disabilities that are experiencing a particular hardship, 3 or none, 3 or more, needing medical care or being food insecure with hunger. And the little colors in the bar represent different measures of disability. So the black is you were limited in the year they asked you the question, but for a short-term period of time. The red is the long-term. You were limited in that year, and it's long, but for a long period of time. And they represent the majority of those with disabilities experiencing the hardships. And the gray is you weren't limited in 1998 when they were actually asking you about the hardships, but you were limited at some time before or after that. So hardships, their disability may precipitate that or be a consequence later of a hardship, but at some point around that period of time, you experience disability. And for every hardship we looked at, I think, except one maybe, people with disabilities, although they represent 40% of the group that has income, low income, 200% of poverty or below, this is confined to that group, they're 40% of them, they were half or more of everyone experiencing the hardships. So probably the most severe one is the food insecure with hunger, or, arguably, and they represent the majority of people experiencing that, 62%. Well, when we were looking at material hardship, we wanted to see, okay, if you control for income and other things you can observe, like age and sex and where you live and your family structure and your receipt of public assistance, are you still, if you have a disability, more likely to experience a hardship? Controlling for everything else that we could observe that might affect hardships. And yes, having a disability is significantly associated with experiencing hardships, every hardship that we looked at, even after controlling for all of those things. So what this slide is doing is it's just taking those prevalence numbers and trying to look at them in terms of dollars. And I mean, you might think, why are people experiencing the hardships at greater rate, even at the same income level? If you're the same, woman with this $20,000 income, with the same level of education, why? Because you have a disability, or you experience hardships at like 3 times the rate as a person who's just like you but doesn't have a disability. And it might be because you have to devote more of your income to disability-related expenses. Or it might be that you don't have access, physical access to things that you need, like health care. You just can't go to the store to go shopping, and that's why you become food insecure every once in a while. But there's lots of reasons of why they might experience the hardships at greater rates. And what this slide is trying to do is say, okay, what income would a person with a disability need to experience hardships at exactly the same probability as someone just like them without a disability? And here we're holding the income at poverty level. That was 2005 poverty level when we were doing this. So a person without any limitations, $10,000 income. What income would someone with a long-term disability, a work limitation more than 12 months, the red bar, need to experience I'll just show you that any of the 6 hardship one is one example I have here. And they would need $34,000, or at least in the multivariate regression framework, holding everything constant, they would need an income of 3 times the person without a disability to experience hardship at the same rate. And I'm only showing you the one here, but the findings were consistent across all of them. Generally, 2.5 to 3.5 times the income a person with disability would need, 2 to 3 times the income a person without disability to experience any of the hardships at the same probability. So, in conclusion, the poverty rates for people with disability are high, especially with those with long-term and also those with severe disabilities. And a large share of people living in poverty in any year have disabilities, and they represent the majority of those when you look at a longer-term measure or a longer period, 48-month period of poverty, or of looking at a 48-month period, their poverty rates are higher, and they represent the majority of those in poverty. They're much more likely than others to experience material hardship, even when you hold income constant and other characteristics. And if the threshold, the poverty threshold, reflected that, if material hardship was somehow taken into account, their poverty standard would probably be a lot higher, and you would see a lot more people with disabilities in poverty if that were the measure you were going to use. All right. That's it. Thank you.
Thanks, Gina. I'm Sean Fremstad again with the Center for Economic Policy and Research. And before talking about what I see as some of the practical and sort of policy implications of Gina's work, I wanted to note some additional recent research that I think helps fill out this picture that Gina painted in her presentation. And there's not a lot of this research in the United States. Most of what there is very recent, and that's one of the things I'm going to highlight here. There is also some other interesting stuff internationally, and a lot of that I try to sort of summarize and synthesize in my paper, if you're interested. So let me just make sure I know how to switch the slides. Okay. Oh, down. There we go. Okay. So 53%. This is this number here. It's from a new working paper by Bruce Meyer at the University of Chicago and Wallace Moak at Northwestern University. And what they do in this paper is they basically document the risk of disability for working age men over their lifetime. They use a longitudinal survey, the PSID. That's part of the reason why it's limited to men here, because I think they only had the right questions for men going back. It was literally going back kind of over 4 decades. And they also look at the impact of disability on the incomes and consumption of these people kind of over the life cycle. And basically what they find, and this is kind of, I think, kind of the key finding here, is that about 53% of men will experience a period of disability by age 56. And these are people, one of the things they do is they exclude people who were disabled or had an onset of disability before age 18. So what you're kind of getting is for somebody who's 18, going into their working life over, until their mid-50s, more than half of them are going to experience a period of disability, some chronic, some severe, some temporary, but more than half will experience that period of disability over their lifetimes. They also categorize this risk. So here what you're looking at is basically the risks, again, for male household heads over their working lives by sort of differences in terms of time and severity. So I'll just kind of focus on the first 2 numbers there. So that 53 breaks down into a 37 and a 16. So the 37 is that 37% of working age men will experience a chronic ongoing disability at some point by the age 56, 16% will experience a not chronic one, and then you can kind of separate that further as the slide does into by severity again, and kind of by whether it's temporary or part-time or one-time. And then kind of the interesting thing that they do with those is they essentially look at the change in income after the onset of a disability and the impact that that disability has on income. They actually look at earnings, income, and consumption. I'm just going to highlight income here because it's kind of the bottom line is the earning things are more dramatic because you see a more dramatic decline. The consumption is less dramatic, and the income, which includes sort of things like social insurance benefits, DI, is kind of in the middle. But basically what you're looking at here as a chart is this is the decline in income for these men after the onset of the disability over a 10-year period. So the bottom of the chart, 0 to 10 years. And then the top of the chart is basically 0, right? Sort of a 0, basically they would hold steady, and then everything down is these are percentage declines in income. So 10%, 20%, 30%, 40% decline in income over this period. And kind of what you see here is that sort of the story is summarized in that thick blue line, which is all the men who experience a disability. And what you get is basically kind of on average a 10% decline, averaging again across everybody, in income over this 10-year period. It kind of accelerates a little bit. And then when you look at the particularly chronic and severe people with disabilities, you see even a more dramatic sort of decline. So it starts out at about 15%, gets down to about 30. It's kind of bottoms out at about 40% at year 8 until it starts sort of climbing back up again. But even if you look at the sort of one-time chronic, not severe, you see an impact on research, and it seems to be lasting in some respect. Now, they also do something that I think is interesting. They look at the impact of a disability on income before it's actually reported, or before it's sort of recognized, I guess, is one way to think about this in the survey. So these are people self-reporting, and then what they find is essentially a decline in income even before that onset date. So before somebody recognizes, maybe gets diagnosed or whatever, that they have a disability, there's an impact on income. It's potentially here kind of an impact. And it's basically, again, kind of you look at the blue, it's all disabled, it's about 5%. The chronic and severe, it's more, it's about 10%. And you can then put those two together and you get the whole sort of time period. The 5 years before, the horizontal bar is there is year 0 when the onset is, and then you can kind of track it through. And, I think part of what this shows is that disabilities, particularly ones that turn out to be chronic, likely have an impact on income before they're even recognized as a disability by the people who have them. And there's probably sort of, impacts on work and productivity and the like that are showing up even before it's recognized. And I think it has some implications, too, for things like, early medical treatment prevention, those sorts of things, or, making sure accommodations are available and sort of things like that before this sort of slide happens. Now, if you put these Meyer findings together with Gina's results, and this was what really, for me, I come from kind of the poverty world. I had done, I was a legal aid lawyer before I moved to D.C. in 1999. I had done SSI cases. I had represented clients with disabilities. But certainly, particularly when I came into D.C., there was this sort of very stark separation between the poverty world and the disability world, and you didn't necessarily think about them as overlapping much. I worked with a woman by the name of Eileen Sweeney, a great advocate who is unfortunately died far too young a few years ago, and she kind of also was very focused on this intersection of disability and poverty, particularly in the context of TANF, and kind of opened my eyes up a lot on that. But I hadn't, until I read Gina's work and also the Meyer work and some of this other work, it hadn't really hit me like how important and fundamental this sort of interrelationship between poverty and disability is. So with Meyer, you're saying, roughly a majority of all men and probably a majority of all women, too, if we have the data, will experience a disability during their working lifetimes. And then Gina's research is just looking at the people below the poverty line, and also has this, right here the number is kind of a slice in time. If you look at those working age adults with income below who reported disability, it's almost half. And so I think, part of the story here, too, is, sort of this is not a minority kind of small special interest issue. It's kind of a major issue, and one where there's tremendous interconnections. I mean, if you're somebody, for instance, who wants to cut poverty dramatically by half, as many have argued that we should over the next 10 years, or if you're somebody that wants to strengthen the middle class, we've got a task force now at the White House on the middle class, I think you have to take account of these sort of disability issues in that if you actually want to fix the problem, because it's just, it's too much of an issue and too much of a factor to ignore and sort of shunt it off into its own little kind of separate silo. Now, with that in mind, I want to say a bit about 4 policies that I see as important. And these are mostly sort of more policies I guess you'd think of as more universal and not necessarily disability specific, but I think they all have disability specific aspects and are important. Now, the first, I'll just say the 4. The first one is universal health care. The second one is paid sick days and paid sick leave. The third is improving the earned income tax credit. And then the fourth is reforming our official measure of income poverty. So first, universal health care. I probably don't have to say a lot about this. We know 46 million Americans went without health insurance last year. We know it has serious consequences, that it can be deadly. I mean, some 18,000 people, according to the National Academy of Sciences, die every year because of lack of health insurance. It's probably also the case that many become more disabled or have more serious health conditions because of that lack of insurance. And I think here, part of the story is lack of health insurance isn't only a consequence of poverty and disability, but I think also a fundamental cause, and that you really need to move to some sort of universal health insurance program like the one Congress is currently considering to address that. One thing I'd recommend is this David Stapleton and Sue Liu have this nice brief on health care reform and the employment of people with disabilities out on the table, which I think is a good primer, and I think why it's so important as a disability issue, not just for health care reasons, but also because of the employment impacts of going without health insurance. Second issue is paid sick days, and this is something that It's actually gotten a lot more sort of political attention lately. People may remember during the Clinton administration in 1994, the Family and Medical Leave Act provided a basic guarantee of unpaid sick leave for most workers, but no requirement that workers actually receive paid sick leave or time off. So, it's something that people can't afford to do, especially if you're a low-wage or moderate-wage worker. And so this basically shows currently about half of all private sector workers, about 48% here, have no paid days off. Not even a single one. When you look at low-wage workers, that jumps to almost 80%. When you look at, I've got food sector workers here because I would think, the people that made these lunches, we would hope that they are staying home from work and getting paid to do so rather than feeling like they have to go into work. Another interesting one is if you look at health sector workers, kind of outside of nurses and doctors, you get a similar so for direct care workers, you get a similar kind of number of not having paid sick days. And I think, this is an issue where the United States is really a pretty extreme outlier when it comes to ensuring just a basic minimum standard of paid sick days. If you look, this is kind of looking at all, I simplify this chart, so this is a number of OECD countries and gives you kind of a representative sample of ones that provide some sort of basic minimum of paid sick days or paid time off. And so the comparison here is if somebody, say, is absent from work for 50 days, I think the example here is they're getting cancer treatment, they're absent from work. This shows you how many days of paid leave they would get by country, sort of, again, it's a sort of minimum national guarantee. No surprise here, the Nordic nations, Norway, Finland, Sweden, the like, are up there 50, 40 days or so in terms of the basic guarantee. It declines when you look at some of the more Anglo-Saxon nations, the United Kingdom, Australia, but the United States is the only one out there at zero, basically providing no kind of basic guarantee. There is legislation, it's called the Healthy Families Act in Congress. It has been getting some notice lately, especially with the swine flu, and that would require at least 7 days of paid sick days. So it's a pretty minimal, modest start, but it's extraordinarily controversial, especially because a lot of the sort of business lobbies and interests, and particularly restaurant and food type of interests are very opposed to this idea of giving paid sick days. But I think it's one the Obama administration has endorsed and has at least some potential. A third policy I want to talk about around this connection is strengthening the Earned Income Tax Credit, or EITC for short. The EITC, I think people are probably pretty familiar with it. It provides what is essentially a wage supplement to low-wage workers, sort of to boost the value of low wages, especially for workers with children. It's been around since the 1970s, but it's really taken on increasing social policy importance over the last couple of decades with expansions. There was expansions as part of the tax reform in the late 1980s. There was expansions during the first Clinton administration, and there are also some expansions, important expansions in the Recovery Act bill this year. And it's now, it's like a $40 million program, so it's larger, say, than temporary assistance. It's larger than some of these other social policy programs that often get more attention. Research we've actually done at CEPR, and it's pretty sketchy, frankly, but it suggests that at least about 20% of EITC, people receiving the EITC, have a disability, a work disability, or have somebody in the home with a work disability. So it's not a minor, it's actually also reaching people with disabilities, but there's a lot of room for improvement. One is these numbers show it's really bifurcated in terms of the benefits. This is the maximum EITC benefit, 2009, by whether or not you have a child, basically. So if you're a worker with no child, the maximum annual benefit is $459. If you've got one child, it's $3,000. It actually goes up with 2 and 3 children, and there's also adjustments for married couples. And I think this is this sort of disparity, there needs to be a real push to basically expand the benefit for workers with no children. If you look, actually, workers with no children, if you count both their EITC and their minimum wage, that comes to less today than it would have in 1979 if they were just getting the minimum wage. So, there's also been this failure to kind of just keep up kind of at a basic wage level for people. The other thing I think we should consider, and the United Kingdom has an EITC-type benefit. They also have a supplement for people with disabilities, and I think it's worth considering here. We have some other tax policy provisions that provide supplements or kind of, benefits for people with disabilities. I think the EITC is sort of a natural one to have an add-on in that sort of way. And then finally, I think Gina's findings about this disability and kind of the connections between hardship, disability, poverty, suggest that we really need to re-examine how we measure poverty in the United States. This table is sort of a slightly different representation of some of the data in Gina's paper on hardship and disability and poverty, and I wanted to particularly highlight something here. So the first bar, this 54%, that's the percentage of people below 100% of poverty with no work limitation who experience any hardship, basically. So about half. But those are people with no work limitation. And then over there, I've got the next three bars are all people with higher incomes. So these are between 100 and 200% of poverty, not so low income still, but higher incomes, 100, 200% of poverty. And then it also breaks it down by work limitation. So you see, if you look at just the first two bars, you're comparing people below 100% of poverty with no limitation with people between 100 and 200%, and you see what you'd expect, kind of 54 to 36. Hardship declines as income increases. But then if you look over to the people with work limitations, with disabilities, you basically see that their hardship rate is roughly similar, even though they have 100 to 200% of income as those people without limitations and below 100% of income. And this kind of gets at, it's just another way of thinking about Gina's finding on, how people with disabilities need more income for equivalent hardship levels. And I think part of what this suggests to me is that our current poverty measure, which only looks at income and doesn't take kind of hardship or sort of, kind of the whole range of things that can impact kind of well-being and kind of, and kind of really, determine what it is to be kind of experience real poverty instead of just income poverty, isn't really an accurate. So our current measure really isn't an accurate measure of actual kind of poverty or economic deprivation. Now, how could we do a better job of that? I think there's actually a very interesting example here from the United Kingdom. What they've done within the last couple of years, they've adopted a new set of poverty measures, and some of them are standard kind of income measures where they look at income and income only, but they also have a measure that basically combines income and hardship. So it's kind of multidimensional is one way to think of it. And what they do is they look at everybody under roughly 200% of poverty, and then they count as poor those people who have the severe levels of hardship. So you're essentially kind of saying, low income is kind of a threshold thing. You have to have a low income, but not as low as the U.S. poverty line. So it's more like the range, I think, Gina was looking at, around 250%. And then your actual kind of real poverty standard is determined by things like, are you experiencing food insecurity and these other sorts of things. And what it does really is it kind of controls for all these other factors that you can't just build into a poverty measure. And kind of, it's a much more sophisticated measure, but it's also simpler in many ways. And so I think that's something we should really take a look at. We are having a debate. There is legislation on poverty measurement before Congress, and I think it's something that especially the disability community really should weigh in on and develop positions on to think about how to make sure that that measure accurately represents the economic deprivation, economic well-being of people with disabilities. And then just a final slide here. I'm going to close and apologize for this really unwieldy chart. It's one I just cut and pasted. I didn't have the underlying data, so I couldn't simplify it. But the basic kind of the point of this chart is that there are countries who have figured out to provide the same opportunities and economic security to people with disabilities as those who do not have disabilities. And so this is basically the difference in poverty rates for people with and without disabilities in 27 OECD countries. So the countries are on the bottom. Each country has two bars. One is the poverty rate for people with disabilities. One is without. It's a equivalent sort of rate so that you're trying to compare kind of countries on, in a standardized way. And, basically what you see here is the United States. The light blue bar is, the United States, The bright bar is the poverty rate for people with disabilities, and the light blue bar is without. They've got both the highest poverty rates, essentially, of all those countries, and also about the highest gap, or probably, I think they're actually in about the top 5 in terms of the gap between people with and without disabilities. And then if you look down at the very bottom, you see some of our friends that we remember from the paid leave chart, Norway, Sweden, the Netherlands, some of those countries, that essentially both have very low poverty rates and also have really equalized those rates and figured out how to provide kind of the same level of opportunity. I think, we're not going to turn into Norway and Sweden anytime soon, obviously, but I think this is kind of what we should aspire to, both lower poverty rates and sort of bringing down that gap so we really have more equality generally. Okay, thank you.
Hi, everybody. I don't know. You tell me if this is right, okay? Hi. I'm Pam Loprest, a researcher at the Urban Institute, and I do, as Dave said, do a lot of work in welfare and low-wage labor markets. I'm a labor economist, as well as disability policy. And you'll see my labor economist coming out as I talk about, more labor, not less economists, coming out as I talk about my take on this topic, which is a lot around work. But what I want to say first is we're talking about how in the poverty world and the disability world, especially in Washington in research circles, and advocacy circles, I'd say too, somewhat, there's not a lot of overlap. There's not as much maybe as there should be. And part of that, in my view, is in the poverty community, the community that's doing work on poverty, the perception of what disability is, what it looks like, what is disability, kind of a definitional thing, and the idea that those people are taken care of by the SSI-DI programs. And I've seen this a lot, when I go out in the field, when I talk to people in welfare offices, administrators saying, well, what are you going to do? What are the policies that you're going to do around welfare reform for people with disability on the rolls? And they'll say, we don't have anybody with disabilities on our welfare program. They go and apply for SSI. So I think part of that fighting is fighting this perception and this understanding. So education work, right, to be done. I guess I should do the down arrow? The downward. There you go. So for that, I just thought I'd start by who are we talking about when we talk about poverty and disability. I mean, I'm with Gina. It's just astounding, these numbers. And what I really like to highlight about this overlap is that we're not arguing that poverty researchers and poverty policy should look at an additional group of people that they haven't been. We're saying when you look at people in poverty, you should look at this aspect of their life, of their reality, because so many of them have disabilities. And that's really, I think, what we want to be about. But when I think about it, in all the different research things I've done, I think about a young person with disability who no longer qualifies for SSI at age 18, and so they're now in poverty. A less educated worker who's had a low-skill job for most of their life, gets hurt on the job or has some chronic issue and becomes unable to work, and falls into poverty. The older worker who's in their 50s and loses their job because due to disability or can no longer work and has a really hard time finding another job just because of their age too. And then the long-time SSI recipient who has been out of the labor market for so long, for such a long period of time, partly because of the trap that Dave talked about, and has limited capacity to work and limited connections to the workplace. So these are the people that we're talking about, some of the people when we think about this. I want to talk about work as anti-poverty policy. There's a lot of work on employment policy in the disability community, and it's incredibly important. And I think we need to put it together, that in this country, work is the way out of poverty. Employment and being able to earn is really the way out of poverty. But I would also offer it's fulfilling some of the basic goals that we have for people with disabilities of joining the community and of realizing their full potential. And we may have a discussion about that, but I really believe that that's true. We know that the employment rates of people with disability are about half of what people without disability. We know that employment, there's a lot of issues and difficulties around employment. And so it's not surprising that you then flip it and see that a lot of people in poverty have disabilities. We need to think about how our anti-poverty policy in the U.S. is increasingly work-focused, and so we need to have that dimension in there when we talk about bringing people with disability into the discussion. I'd like a little side note to say I've done a lot of work on welfare reform and welfare policy, and we might even need to think about our social safety net talking about poverty even. I mean, a lot of the social safety net conversations that are happening now talk about work and how to help people with work, and a lot less about getting people out of poverty. So there is an issue that we really need to reach out and talk about the employment poverty disability connection. But of course, it's not just work alone. This little quote is from the Poverty Trap paper that Dave and Gina and others did, and I love it because I really think it's our goal, the maximum economic self-sufficiency at a reasonable standard of living. Maximum economic self-sufficiency, which isn't going to be for everybody the same, at a reasonable standard of living. And that goes to the measurable hardships, not just a dollar income amount. A long-term income support system is necessary, and as Gina's data shows, and as Dave mentioned, people in poverty with disabilities, people who are under that very low level, are on disability benefit programs. I mean, that does not get you out of poverty. It's not an adequate amount of money to get you out of poverty. So there's that issue in and of itself, the adequacy of those benefits. But the idea of work supports, policies that will help people work, continue to work, get into the workforce, as well as what Sean said at the end, the wage income supplementation for low-wage workers. And I want to talk a little bit and highlight some of these policies thinking about for part-time workers or for workers who are working at their maximum economic, they're at the amount that they can do for work, and yet it's not there all the way towards the standard of living. And how can we do supplementation in that respect, and what kind of policies do we have? So this is the safety net programs, the income-targeted ones that are for people that are really focusing on the lowest income individuals in our society and what they have. And there are studies, these are effective in reducing poverty. Not everyone in these programs is in poverty. It does reduce poverty by something like half, the combination of these programs. So we have success there, but obviously we still have a lot of issues. I'm not going to say much about this because I think we in this room and listening probably know a lot about this and about the poverty trap of disability benefits, the difficulty of once you're on being able to work and keep income, and the difficulty in receiving those benefits and proving that you can't work to be able to get them and what that does. So there's a lot of issues around that we need to really focus on. And one that I want to highlight that Dave mentioned too is the inability to really combine in a meaningful way work and those kind of benefits. That these SSI and DI are not programs that are going to allow you to work part-time at a reasonable wage and then supplement. And what can we do about that? But I want to talk about the group that's not eligible for SSI. And I kind of mean this in a broad way. There's individuals who are not eligible for SSI, and some of the work that I've done in single mothers and people eligible for welfare, temporary assistance, looks at these individuals who are not meeting the SSI definition, and so but still have disabilities and functional limitations that make work difficult and put them in poverty. So there's that group of individuals, and that's real, and I think we need to talk about part of that is temporary disability. But there's also at-risk group, and we don't want to talk about our anti-poverty policy being talking about those who are under 100% of poverty, because what we really want to do is prevent people from falling into poverty. And what I think is we need to focus on policies, or have a good focus on policies that look at those who are at risk for, if the onset of disability happens, they fall into poverty, or are just really close to the edge. They're the low-wage workers that are hanging on, are in and out of the labor force, and have only limited sources of income, and for which a disability or an increase in the limitation that they already have just throws them over the edge into poverty, or who their policies can really help that person stay in the labor market or make it in the labor market. So Sean already talked about EITC, so I won't, but it's really important to realize it's our biggest program that's really an anti-poverty program in this country, dollar-wise, and it is work. You don't get it unless you work some. It's an earned income supplement. So that's an important source of supplementation to think about and expanding in the ways that Sean mentioned. I want to just say a few words about TANF, which is the Temporary Assistance for Needy Families Program, welfare, often called welfare. It's really small now, getting smaller by the minute, Elizabeth laughed. And it's mainly serving women with children, so it's not, the things I want to say about it are, I think, instructive for the broader view of trying to make work policy, anti-poverty policy. And in this welfare reform and trying to do just that, to turn a welfare program into a work-encouraging program, there was a lot of work to put incentives for work, keep more of your income, your earned income, as well as mandates. There was a lot of efforts, especially initially, in trying to do innovative things around employment for people that had, in the previous world of welfare, been put aside and said, you're what we call exempt. We're not going to require you to work, but we're not going to help you at all. We're not going to try and give you work services. But I think what the experiments have shown since then is how difficult it has been to help, especially those with different kinds of disabilities, to get work, and how the evaluation of programs, employment programs that are trying to encourage work, provide training, do a lot of the on-the-ground work of getting people into the workforce, we haven't seen huge amounts of success. Now, we need a lot more evaluation, and many, many programs exist that have never been evaluated, so I don't want to say we don't know anything that works, but the success has been limited, and it's not free. It can be costly to do this kind of investment, and it often increases work, but to low levels of earnings, either because of the really low wages people can earn or because of part-time work. So supplementation still is an issue of how are we going to do this combination so that people can be able to get to that standard of living that we want. I also think we need to think this is really brought to the fore that one small program like TANF is not able to provide all the support systems that are really necessary, especially for people with disabilities. And in the TANF world, one of the things I think we've seen is the woeful state of the mental health support systems that are really the TANF, the work programs, they're not there to reach out to. They're not able to partner with really well-working, efficient, easily accessible, available services. And I think this is true for other parts of the system too, but I just point out mental health because it is a serious issue, and it shows that work support policy is beyond, an anti-poverty policy is beyond just getting the dollars to people, and even beyond just saying, well, we can train you or try and get work, that kind of services, but the health and other ancillary services have to be available too. So I could say a million other policies, and I know I'm probably running out of time and want to move along, but I cannot not mention the policies to invest in work capacity. I think that when we think about individuals who are at risk of poverty, we're often thinking about people who have had very low levels of education and have not been served well by our education system, and that includes individuals who had early onset of disabilities, as well as younger people with disabilities trying to get back into the educational system. And that we know, I don't think I put it here, but we know that the dollars, the way to actually earn and be able to take care of yourself and your family well is through education. So I won't say anything more about that here. I say some more about these employment training programs. But improving educational outcomes has got to be a key part of our anti-poverty policy for people with disabilities and the specific issues around that. Some of these issues are policies to support work. So we invest in work capacity. We want to support work, and Sean mentioned the paid leave and health insurance. And I think that for people with disabilities, especially in the low-wage workplace, the issues of accommodations and anti-discrimination are huge and really need to be thought of as well as anti-poverty policy. A low-wage worker who can no longer return to that job because of something that happens to them, is accommodation available to them, in that job. And then this is just to highlight policies that support work but are particularly around the onset of disability. I think that's an amazing statistic, the 50% of people will have onset. This is a different paper that I cite here that shows that the poverty rate doubles at the onset of disability from 51 to 64. Because the onset of disability is an event that leads many, many people into poverty at all of these different ages. And we need to think about that, and we have to have a solution to prevent poverty at that point, which is not just SSI or DI. And unemployment insurance reform, there's been a lot of work for talking about unemployment insurance reform for part-time workers, not with reference to disability, but I think the disability community should be there. Temporary disability insurance, we saw short-term disability because I think of its reduction in people's ability to work causing high hardships, and that means we need something temporary. And remaining attached to work. I mean, these are not new issues. These are issues that are talked about in the disability and employment literature a lot. But I think bringing it to a focus of low-wage workers and anti-poverty policy is important. So I'll just conclude by saying, work is the key goal to helping people get out of poverty. And we need the appropriate investments and incentives and supports, and they're not in place now. And income support and supplementation, especially for part-time work, really needs to be part of that. And I would hope that we can all, bring this discussion to the world of people doing poverty research, and not just the disability community, but to educate about who we're talking about, what we're talking about, and how a lot of the policies that are regularly talked about in anti-poverty discussions are policies that can help people with disability. They just need to be thought of through that lens and make sure that that is part of the discussion.
Oh, thank you all. So, what we got done? Well, we did pretty well, I think. Didn't quite make 1 o'clock, but pretty close. So, questions from the audience. Let's see. Derek, you've got the mic. Okay. And so Derek will bring you the mic, and if you just say your name and your affiliation, please. And if the speakers would come up here, then we can pass this mic around while we're answering questions. You don't want to do that. What? Yeah, I was going to have you all come up here and stand. We have to stay behind the speaker unless you want to hear feedback. Go ahead.
Okay, I'm Bruce Klein, the George Washington. I'm Bruce Klein. This is better, isn't it? Yeah. I'm Bruce Klein, the George Washington University. I enjoyed the presentations very much. I'm glad I came today. It's kind of a struggle to get down here, but I'm glad I struggled and made it. And I just have a few comments. One is that it's important to realize that the results are model dependent. So the results of all these, of other people's works that you cited are dependent on the models. And now I'll make a shameless self-promotion. I'm a founding member of the Infometrics Institute, and the Infometrics Institute is delving into a whole range of new econometric and mathematical models that we're really going to have a very, very positive effect on research. And it's brand new, and it's very promising. My second comment is that this is in relationship to new poverty measures. I heard Rebecca Blank speak just several weeks ago, and Rebecca Blank is now the Undersecretary for Commerce in charge of Census Bureau and BEA, and her sworn mission is to come up with a new poverty measure, which you probably know. But Rebecca favors a single level threshold because that's the most useful for policy purposes, because there's just one threshold out there, so everyone is measured against the same standard, and it can be applied across many, many programs and replace the current Orshansky measure. Thank you.
Thank you. I'll just comment on the poverty measurement. This is something, Rebecca and I have talked about this. We've had a lot of, there's kind of a little debate about this. What you're talking about is it's a measure developed about 15 years ago by the National Academy of Sciences, and it's incorporated into legislation right now, and there's been a lot of eagerness in getting the Obama administration to adopt it. I think this is a measure, it has many strengths. I mean, it has a better, most notably, I think it does a better job of measuring income, so things like the EITC that we really should be measuring. I think, though, it's still, I see it more as one part of what we really need. And why I'm interested in the United Kingdom's approach is they basically, they took a year and looked at this kind of based on the most recent research, not what was out there 15 years ago, and they decided what we need is a tiered measure, one that both basically has an absolute standard, a relative standard, so the absolute adjusted for inflation, the relative tied to income, and then we need this multidimensional standard that also takes a look at hardship. And I think if what you're trying to do is get a kind of an accurate statistical picture of poverty rather than develop a measure, say, to decide where to set the food stamp threshold or SSI threshold, kind of income threshold. If what you really want is the most accurate picture, then I think a tiered measure is the way to go, because it actually, you don't have to do all these things. The other thing about the NAS standard is it includes things like geographic adjustment. So you've got essentially 50 different thresholds because each state has its own threshold. And right now, there's different thresholds for the elderly in the legislation, essentially, or people with housing equity. So it actually ends up being very complex. And so you don't really have a single standard anyway. What you've got is a lot of different standards. So I'm not saying that we shouldn't do the NAS. I just think we need to have a broader look. And particularly with people with disabilities, I think it's important to have a measure that doesn't just stop like the NAS does at this fairly low threshold. It's got to include this kind of people up to 200% of poverty. And I'd kind of go further and say we probably need to rethink some of the terminology and think about, is kind of our way of thinking about poverty is just a very low income standard that really the right way to think about it.
Ellen O'Brien, AARP Public Policy Institute, and I just want to follow up on that, getting to the more mechanical level, and ask Gina, are you able to look at people with disabilities in the NAS, in the research files that allow you to compute the new poverty measure, or do you have a plan to do that? And do you have any intuition about what the NAS poverty measure would mean for our understanding of who is poor and who's not? For example, including the EITC and deducting medical expenses, things like that go into the NAS measure.
Well, the current official measures are based on the March supplement of the current population survey, and until this year it didn't, they started in 2008, middle of 2008, there weren't any disability measures in there at all except work disability and work limitation measures. And so if we're talking about using that data to generate these official measures next year, they do it on a lag, so the 2009 numbers will be the first time that people with disabilities are reflected or can be reflected in the official measures. Now, regarding the proposed new measures, I don't think the research has looked at that. I remember reading those papers a while back, the NAS, and I know there was something in there about the health insurance, and I don't know if that's what's being proposed now, and Sean might be able to address that aspect better.
Yeah, and this is something, I think it's it's in one of my papers. I wrote a paper on the NAS measure about a year ago. And Census they've done it once. They've put out a disability, poverty measures for disability, non-disability. I forget, they probably use a fairly narrow definition. And what they found is that with the NASH measures, the poverty rate for the disabled would be lower than it is now. And there's a lot, and this is one of the issues with the NASH measures too, there's a lot of demographic changes. So the elderly poverty rate would actually increase by about 70-80% under some calculations. State poverty rates would change very differently. The poverty rate for the disabled would actually go down because they're counting more benefits. Essentially, they're counting food stamps, they're counting public housing. And that's another reason why I think it's actually very important for the disability community to take a look at this measure and kind of see should there be additional kind of adjustments to the measure that take into account the specific conditions of the disabled. The measure was designed at a period when it was very much welfare reform, and they were focused on things like work expenses, and I think they hadn't focused as much on the specific implications for people with disabilities in designing that measure.
We have a card in the back. Go ahead.
Thank you. Question and a comment for Gina. I'm Andrew Sperling with the National Alliance on Mental Illness and the Consortium for Citizens with Disabilities. In your hardship measures, and a comment too if I could, in your hardship measures, did you make an attempt to look at housing status and rent burdens and things like that?
We did not.
Okay. So here's the plug. HUD's principal measure is what's called worst-case housing needs, which is paying 50% or more of your monthly income for rent or living in substandard housing. Now, at least many of us believe that this probably is the most sort of stark measurement of relative poverty of people with disabilities. The challenge, of course, is that HUD does a terrible job of measuring worst-case housing needs among people with disabilities. They count people living in institutions, psychiatric hospitals, nursing cares, board and care homes, ICFMRs, you name it, as being, quote, housed, therefore they have no rent burden. So they vastly undercount the number of people with disabilities that experience worst-case housing needs. But we believe this is in many cases, the most acute measure of poverty of people with disabilities when we sit down and compare SSI income levels to fair market rents, because HUD largely measures poverty on a completely different scale, not the poverty level, but rather area median income. And so that's how they target HUD programs like Section 8, like public housing, like the low-income housing tax credit. And what you find is that HUD's programs do a pretty good job of serving people at 50% of area median income, but a terrible job of serving people below 30% of median income. And people with SSI are at 18% of area median income on average. And then when we compare that to fair market rents, we find housing markets where they have to pay essentially 150% of their monthly income to rent a modest one-bedroom or efficiency apartment. So I want to make the case for trying to measure housing, because that, in the end, becomes, I mean, I see these measures about food security and things like that, but if you, these surveys we see of people with disabilities among our own membership, their number one anxiety, their number one challenge is finding access to decent, safe, and affordable housing in the community. And we're seeing this actually being the number one barrier to policies like Olmstead and the New Freedom Initiative and all these community living initiatives. All of them are stalled because we have a really difficult time getting the affordable housing system to serve people with disabilities because of policies that were enacted back in the early 90s that allowed housing authorities to say, you know what, we don't have to serve people with disabilities. And we see people with disabilities completely excluded from the entire portfolio of some housing authorities of their 0 and 1 bedroom units. So this housing challenge is something that is very difficult for, I know, for all of us to get our, you know, for people that measure poverty to get their hands around. But I think it's one area where the disability community actually is very integrated into what's going on in the larger poverty community with the Low-Income Housing Coalition pushing for legislation on Section 8, on the new National Housing Trust Fund. But this is really a big, big issue for the disability community. So sorry for the...
No.
Well, one thing that's going to help with that, I know what you mean about measuring, especially federal poverty policy level, is the measures in the American Community Survey and the work that's been done to improve measures of disability, which then can be put in the American Housing Survey and other surveys that don't, a lot of other surveys that don't measure disability well, so you can start to get at that kind of, at measures of that kind of issue.
We should really improve the SIP measures too, frankly.
Derek?
Hi, I'm Dara Baldwin, and I'm the advocacy policy person for TASH. And I have a plea to you. Before coming to here, I went to Center for American Progress, and they rolled out their proficiency in high school education report, which discusses bringing children through the educational program, making sure they go to college. And this is to you, Pam, when you had in your slide about disability. Not one part of their report discussed people with disabilities. So I would ask that you reach out to them and discuss this. The Department of Education was there, and I was there for an hour and a half, and not one person on the panel mentioned children with disabilities and their dreams to go to college and the need for them to go to college. So my plea is to reach out to those people doing research on that area.
And I hope you stood up and said something about that. No, but seriously, yeah, you don't seem shy. Because that's part of the education. I totally agree with you. It's very marginalized.
First, just a point of information. There is, I'm Joan Turk. I'm with the Office of the Assistant Secretary for Planning and Evaluation, HHS, but I'm also chair of the Committee on Statistics and Disability of the American Statistical Association. I think, I don't know if everybody knows, but the CPS is testing questions that will permit them to do the National Academy poverty measures. They're going to replace some of the welfare questions. And there's a clearance package at OMB. I'm curious to know how you measure disability in your study because of the paper that shows there are 64 different definitions of disability in federal programs. Yeah, and that will influence the answer you get. Do they have to have 3 or more ADLs? I mean, what are the measures to determine?
The paper has about 1,000 statistics showing it any way you want to slice it, pretty much. And that was the point. You know, when you slice it based on duration, when you slice it based on severity, when you slice it based on functional or ADLs and IDLs versus sensory limitations versus something else, you're going to get a different answer or a different perspective, I should say. So we didn't use one definition. We used a lot of definitions to try to get different angles on it. I only showed a tiny percentage of the numbers in those papers.
I mean, I should say, too, you know, when I wrote this paper, coming from the poverty world, I really tried to get my head around what is disability and how is it measured, and coming at it from new. And it's, you know, I think part of the answer is there's just not, it's not this easy, like, either or one answer thing, and you know, particularly things like the International Classification of Functioning that the World Health Organization did, I think give you, you know, a much better feel for sort of the intricacies of it, and it's not just a sort of inherent in people thing. So, you know, I think that's the kind of, it takes all this complexity, I think, in a way to really get at it.
There's an article published in the Trans this year by Michelle Conley, Disability is Complicated. Michelle Conley had an article in Chance called Disability is Complicated, and she was involved with the design of the SIP disability questions. She's now retired, but I think she, you know, was extraordinarily good. And her paper really gets into all the issues involved. If you can't get a copy of it, if you email me at joan.turk@hhs.gov, I have it, and I'll send it to you.
Okay. I was just trying to figure out who I need to look at. My name is Susan Daniels, and I just wanted to add, Pam, to just add a little bit more information to your great discussion about these issues. We've been studying very recently what happens to people with disabilities when they graduate from college. And I just want to start off by saying that half of the people with disabilities who start college don't finish. And the other half, the 50% that do finish, about 50% of them do not enter work within the next 5 years. So even though we say education is a great springboard, it doesn't seem to have as much spring for people with disabilities as it has for others. And I think that's a terribly depressing scenario. Of those who do make it to employment, I think we see that they come close to doing as well as non-disabled people. So we know that there is a goal there that is really important. But I want to say that the right now the springboard using education is very problematic, and I think very depressing.
Thank you. John Tambernino, the Office of Retirement and Disability Policy at the Social Security Administration. Two questions. The first could be posed to any of the presenters, but I'll pose it to Sean. Most of the discussion of poverty has implied that poverty is best thought of and perhaps exclusively thought of in terms of income poverty. Many of us have been arguing for a few years now that a fuller, more meaningful definition of poverty would include asset poverty. So to me, an important issue in thinking about the disability poverty connection is looking at asset poverty. Now, many of the low-income disabled are asset poor out of necessity, and that SSI and Medicaid have such strict asset limits. If they had assets, they had to spend them down simply to qualify for the program. So I would suggest another research question would be looking at asset poverty amongst the broader population of persons with disabilities. I could only imagine it would be significantly higher than the non-disabled population. Quick plug, the Department of Labor has recently convened an interagency work group that I'm on looking at the intersection of disability and asset poverty. And we're going to be doing some new research, we hope. Second question for Pam. You said that that TANF is instructive, and TANF involves incentives and mandates. And I'm wondering if you could say how you think mandates in TANF and welfare reform could be instructive for this policy area.
I'll just say something about asset poverty. I think that's a great point. And admittedly, I haven't kind of gotten my head around asset poverty as an issue completely. I've worked a little bit on assets. But one of the things I like about these hardship approaches is it sort of takes that into account, right, without actually measuring it. Because I think there's a lot of difficult measurement issues about asset poverty, and you see it actually in policy with things like spend downs and the like. And so the hardship stuff, what I like about it is it's a proxy. It recognizes that, income isn't the only way, isn't the only thing, and it's a proxy for deprivation at least, even though, I think ideally you need an asset measure too, probably. And some of where it shows up, like with the NAS, this asset issue shows up, I think, with the elderly. I mean, part of the reason you see such a higher poverty rate for the elderly when you use an NAS measure is you're taking medical expenses into account, but you're not taking their higher levels of assets into account. And so until you really actually, so you got to figure out a way to do that, and it's very complicated, and it creates a lot of disparities. And I think it also undercuts, it's a problem for people with disabilities because they do have less assets, and kind of it creates all these equity issues, I guess, is what I'm saying. So I think it's a great point, and I'll be interested to hear more about this working group.
Before I answer your second, I'd just say that when studies that have looked at over time, like the one Sean showed of people's income over time given onset, assets involved in that slow decline of people using up their assets before they go on SSI or DI. Mandates in welfare reform, I look at people I know who know this well. I think it requires very close look to figure out, are there useful ways to talk about mandates in other programs around work that might help. And it's very, very complicated the way it works in TANF. It's not, there are mandates on state programs getting block grant money around what they need to do and how many people they need to have in work, and there's a lot of incentives and things that happen around that kind of a mandate. And then individual states have mandates of different sorts in terms of how much job search you need to do before you get benefits, and how much job search and work you need to do to continue benefits. So there's a lot of mandates are kind of come forward in a lot of different complicated ways. I know people don't like the word mandate, and it can sound anti-choice, which is what we want people to be able to choose. But I think that it's just to say that there are roles for incentives and requirements, kind of that contract between people receiving and giving. And so I just think it's an area that we need to think a lot more about.
Okay. I think we should take one question from the remote audience. Deborah? Actually, be careful about that.
Yeah. Well, there are many questions here. One, I think for Gina, we can lump a couple here together. Questions about how the results might vary by gender or disability type, I think in particular regarding increased hardship? And then also a question for Sean about countries with lower rates of poverty for people with disabilities. Are they focusing on work or public benefits?
With respect to differences in hardship across the types of disabilities, we did look at that. It didn't wind up in the paper that actually got published just because there were so many numbers, there's only certain things. And the full report, which if a person wants to email me, I could send them. But the reason we ended up focusing on the work limitation measure in that paper is because it was measured monthly, and you could line it up for when people were reporting the hardship experiences, whereas the functional and the characterizing disability in terms of the activity limitations, functional limitations, those were measured in 97 and 99, right around when the hardship was happening, but not during that same year. So that's why we didn't put as much emphasis on that, although qualitatively the findings were the same. The longer duration, the more severe, the more likely you're going to have the hardships. Sorry, who got the second question?
So the question was about, I guess, that last chart, the international comparisons that showed much higher poverty rates, both for the disabled and non-disabled, for the United States, and much lower. And I think the story there is both a work and a public benefit story, basically. I have to look back. I also had a chart looking at employment rates for a similar group of countries, and if I'm remembering right, those countries with low poverty rates, and the Nordic nations are kind of an example of this, also tend to have very high employment rates, and they're very sensitive about some of the issues about, we think of them as these kind of great welfare states that just hand over benefits, but they actually have fairly kind of very high employment rates and are able to kind of, I think, come up with the right policy mix. So I think, and here in the United States we have very low employment rates. So I think there's something of a false dichotomy between kind of the work versus benefit thing. I think it's all about how do you make those things work better together without creating kind of poverty traps and the like. Just one of these issues about incentives, too, I think, it gets back to this John's point about incentives versus mandates. If you look at something like the EITC, that's not a mandate, really. It's an incentive, but you do have to work to get it, and it's designed, I think it's designed very well, at least for people with children. I think the problem there is, and there's a few studies now that basically say, the increase in single mother employment during the 1990s was really more about the EITC, which happened in 1993 and kind of, was much more of a catalyst, arguably, for things like the caseload declines and the increased employment than some of the more mandatey stuff in TANF. A lot of people had already left, frankly, by then. So, I think, again, it's kind of this right balance in making sure that with programs like the ITC, we're actually making them available to people who could benefit from them.
One last question.
Real quick. Hello, I'm Deborah Titus, and I'm a senator representative for Fairfax County Disability Services Board. And I want to ask all three of you if you ever have any outcome coming from a Workforce Development Act 1999, Ticket to Work Program 2003, Schedule A appointed authority from OPM. I suggest that you present that later with research studies to those entities. OPM as a state rehabilitative services. Can you do that?
Can we repeat the question?
Yeah. I'm not sure I understood the question.
I thought it was basically, so it's about this sort of work around Workforce Investment Act, Ticket to Work,
right.
Like, and which I'm not.
Yeah, you're not involved.
That's why I had to you.
Okay. I understand. Yeah, all right. Yeah, we're actually, we are planning some future forums on those topics, so we'll be doing that, yes. So before we close, I wanted to announce our next forum, and I think there's a flyer outside on this, so you can pick it up on the way out, and I believe it's on January the 20th, same time, same place. The topic is going to be variation in the, I'm not sure exactly the title, but it's about variation in the receipt of vocational rehabilitation services by state and by demographic characteristics of people with disabilities. Todd Honeycutt is going to be doing a presentation about a paper that he and I wrote on this topic recently. And also we have Yunsin Tai from the Government Accountability Office they've had quite a substantial effort going on in the area of disability policy, and they've recently completed a report on recommendations for options for changing the formulas for funding VR agencies, the state VR agencies. And then we'll also have Carl Suter from the CSAVR to the whatever that stands for, Council on State Administrators of Vocational Rehabilitation, to provide commentary on the policy implications. So I hope to see some of you there, and thank you very much for coming today.